My name is Jenna Petersen, and I am an Indiana State University LPN to BSN student. This is my community health education project for Nursing 444 Community Health. Today, this presentation is about nursing considerations for a diverse patient population. Please take time now to use the link below to access the pretest. As nurses and healthcare providers, it is important to be aware of systems in place that may put our patients at a disadvantage. Being aware of differences and needs of a diverse patient group can guide us to better serve them. Patients with poor experiences with healthcare are at risk for poor outcomes as well. Some considerations for nurses dealing with a diverse patient population include being aware of racism. African Americans have faced much injustice in the medical world, and systemic racism is a consideration when working with patients. Discussing how it affects them, being aware of mistrust, and acknowledging prior issues is important. It is also important to be aware of health literacy. Health literacy is the ability of people to find, understand, and use information to make health decisions. Low health literacy is a huge barrier to effective communications with patients, and therefore a barrier to effective care. They may not understand the why of what you are telling them. It's also important to consider language barriers. Now more than ever, telehealth can bring a diverse patient group and a diverse variety of languages, and you may not share a native language with your patients. Also, health information can be quite complex, and so patients who do speak English may still have trouble understanding. It is also important to consider visual or hearing impairments. Patients with visual or hearing impairments should be catered to whether they are aware there is an issue or not. They may be embarrassed and not explicitly tell their provider they did not understand something. Tools for communication while addressing racism with your patients can look something like this. You can watch for signals of mistrust, such as closed posturing, eye rolls, and folded arms. Something you might say as a provider include, is there something on your mind? Is there anything that might help me understand your situation better? It's also important to identify experiences of racism. Naming it shows that you validate its existence. The healthcare provider may say something such as, are you concerned with racism in healthcare? And what does racism look like from your perspective? It's also important to acknowledge prior harm when patients say things such as, that doctor didn't listen, or they didn't do anything for me before. As a provider, you may say something such as, that sounds frustrating. Sometimes racism is involved in stuff like this, but I want to do what I can to help you get the care that you need. It's also important to offer partnership with the patient and allow them to describe their goals for care. Something as simple as saying, I will explain a plan that I think will work, and then we can discuss your thoughts and customize it for you. This puts the patient and the provider on an even playing field. It's important to be able to identify low health literacy. These are some things that low health literacy can look like when dealing with patients. Low health literacy can look like unfinished forms or many spelling mistakes on finished forms. It can also look like missed appointments, non-compliance with medications, inability to provide health history with accuracy. Often they ask fewer questions during appointments and they sometimes do not follow through with labs or referrals. It's also important to be aware of language and communication barriers. Patients with differing first languages is at an all-time high as telehealth becomes the new normal. Many patients may speak English but is not their first language. This can lead to increased inequality in healthcare. It's also important to discuss visual and hearing difficulties. There are many patients who struggle with visual or hearing impairments. Masks now make it more difficult for patients to read lips and pick up on nonverbal cues. Tools you can use for patients with language and communication barriers include using plain, non-medical language when possible, limiting your information to 3 to 5 main points, being specific and concrete with your recommendations, using visual aids such as demonstration or videos when teaching patients, including a summary with repeated key points after your visit, and using positive and encouraging language with your patients. It is our job as healthcare professionals to reduce inequalities faced by our patients where we can. In a time where information is everywhere, we are ethically obligated to educate ourselves to better serve the community around us. Please take time now to use the link below to access the post-test and the summary of this education. For more information, you can visit these references.